Hello, good day everyone. I am Guadalquiver from BSN 11G Group 27, and so for today, I'm going to perform a proper written demonstration about the assessment of the abdomen. So this is done to determine early health problems. So first and foremost is we need to check for the patient's medical record, if any. Second is we need to determine the scope of the assessment and prepare the equipment to be needed. So we have this stethoscope, we also have the tape measure, the marker and the pencil, we also have the notebook, and also the gloves, and also the comprehensive assessment form. And also perform hand washing in order to deter the spread of the microorganisms, and don gloves if needed. So I already closed the door, fixed the curtains, adjust the room temperature, and provide adequate lighting for my patient's comfort and privacy. So hello, good day sir, how are you feeling today?
Thank you.
Okay sir, thank you. So it is important to greet the client in order to establish a good rapport between the healthcare provider and the patient. So sir, let me introduce myself to you. I am Guadalquiver and I am your student nurse for today. So may I know your full name please? Okay sir, so when is your birthday?
Yung 7%.
Okay, so how would you like me to call you? Okay, so which language do you prefer? Do you prefer English or Bisaya? Okay, sir, thank you. So sir, Ben, the procedure that I'll be doing is I am going to assess for your abdomen. This is done to determine whether there are any abnormalities in your abdomen, and I'm going to touch some parts of your body, and there are certain procedures that we need to follow. Is that okay with you?
Yes.
Any concerns or any questions? Okay, thank you. So, ensure that the client has empty his or her bladder. So, sir, have you urinated first?
Yes.
Okay, great. So, sir, I'm going to ask some questions. So, sir, do you feel any pain in your stomach or are you uncomfortable right now? Okay, that's great. So, do you have any past health history such as incidents of abdominal pain and constipation? Okay, that's good. So, have you experienced a change in appetite? Okay, thank you. So, what did you ingest or what did you eat last 24 hours? Okay, thank you, sir. So, first and foremost is position the client into a supine position. Cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. Observe for abdominal skin. Note for any vascularities such as visible dilated veins or spider veins. Note for any striae or stretch marks. Assess for scars, lesions, and rashes. Note the history of scars and document its location by quadrant and reference line. So please sir, I'm inspecting your abdominal skin. I see that it is intact. Okay. Inspect for the umbilicus for its color, contour, and location. Okay. So I see it is normal. And inspect for the contour, the round, flat, or distant. While the client has a flat supine on the bed, sit beside the client, look across the abdomen at a level slightly higher than the client's abdomen. Okay. So, inspect for the abdominal girth. Inspect the area in between the lower ribs and pubic bone and note for any abdominal enlargement. Measure the abdominal girth using a measuring tape and the same line of the day, ideally in the morning. Ensure that the client has empty his or her bladder. Position the client into a standing in supine position. The client's height may be slightly elevated or arthroporic patients. Use a disposable, easily cleaned tape measure if tape measure is not available. Using a strip or cloth gauze, then measure the gauze with a cloth tape measure or yardstick. Position the client into a standing position also. Place a tape measure behind the client and measure the starting on the umbilicus. So sir, I'm going to measure for your abdominal girth. And also record the distance and designated units or centimeter or inches. Take all future measurements from the same location, especially for noted distension. So mark the abdomen with a ballpoint pen 8 in measuring site and ask the client not to wash the mark until it is no longer needed. So now we are going to check for the symmetry. Ask the client to raise his or her head further to assess the herniation or diastasis. Or example is the bulge. So sir, can you raise your head? Okay, you can go back now. And also inspect for the abdominal movement when the client breathes. So sir, kindly inhale and exhale for me please. Okay. And now observe for the peristaltic waves. So now we are going for the auscultation. Use the diaphragm of the stethoscope and make sure that it is warm before placing the abdomen. Apply light pressure or a simple rest on the stethoscope if the abdomen is tender on point. Perform auscultation starting with the right lower quadrant, right upper quadrant, lower upper quadrant, and the left lower quadrant. Listen to each quadrant for 5 minutes, minimum to 1 minute per quadrant to confirm any absence of vowel sounds. Note for the intensity, pitch, and frequency of the sound. Auscultate for vascular sounds. Use the bell of the stethoscope to listen for further bruits, low pitch, murmur-like sound pronounced over the abdominal aorta, renal iliac, and femoral arteries. Now, auscultate for the venous hum. Use the bell of the stethoscope to listen for venous hum in the epigastric and umbilical areas. And auscultate for friction rub over the liver and the spleen. Place a diaphragm of the stethoscope over the right and left lower rib cage and listen for friction rub. So now is we're going for the percussion. Percuss for tone. With the percussion hand technique, lightly and systematically percuss the all quadrants. Percussion may proceed clockwise up and down over the abdomen. And also, percuss the span or height of the liver by determining the lower and the upper border. Determine the lower border by percussing beginning from the right lower quadrant at the mid-clavicular line then upwards. Note for any change from tympani to dullness. And also mark the area of dullness. This is liver border or dullness. And also assess the descent of the liver. Locate the liver border for dullness. Ask the client to take a deep breath. Observe for the descent of the lower border of the liver dullness below the costal margin in deep inspiration, and tell the client to hold his or her breath. And perform percussion, ask the client to exhale forwards. So, sir, can you inhale for me, please? Exhale. Okay, thank you. So now, percuss the upper border of the liver. Locate the upper right chest at the mid-clavicular line and percuss downward. Mark the point where change from the upper right chest, lung resonance until the liver dullness is noted. This is the upper border of the liver dullness. Measure the distance between the two marks. This is the liver span. Repeat the percussion of the liver at the mid-sternal line. And measure the liver span. And it measures 9 centimeters. Now, percuss for the spleen. Begin percussion of the posterior to the left mid-axillary line and percuss downward. Note the change for the lung resonance to splenic dullness. Okay, I'm going to percuss for your spleen. And perform a second method or percussion to determine enlargement by asking the client to take a deep breath and start percussing on the last left interspace at the anterior axillary anicillary line. So, sir, can you take a deep breath for me, please? Exhale. Okay. So, blunt percussion of the liver. Ask the client to sit with his or her back to you. So sir, kindly sit for me, please. Can you stand for me, please? Okay. And place the left hand at the face against the lower right anterior rib cage. And use the ulnar side of the right fist and strike at the left hand. Okay. And note for any tenderness upon percussion. Okay. So now, blunt percussion for kidneys. Ask the client to sit with his or her back to you and place the left hand on the costovertebral angles. And repeat the steps 44 and 45. So, okay. Okay, you can now lay in your bed, sir. So now we are going for the palpation. Position the client in the back supine position. Cover the upper and lower body parts with a bed sheet, leaving the abdomen exposed. Begin palpating a non-tender abdominal quadrant. Use fingertips to compress the quadrant to a dip of 1 cm in a dipping motion. Lift fingers gently and proceed to the next quadrant. Begin the palpating deeply on all quadrants to delineate organs. Use the palmar surface of the fingers to compress the quadrants to a maximum of depth of 5 to 6 centimeters, and note for any resistance or any deep structures. Perform by manual palpation if resistance or deeper structures is felt. Okay, so now we are going to palpate for masses. Use 4 fingertips to compress all quadrants to a dip of 1 cm in a dipping motion. Note for any masses in size, location, shape, consistency, democration, consistency, and tenderness and mobility. So now, palpate for the umbilicus and its surroundings. Note for any swelling, bulging, or masses. So now, palpate for the aorta. Use the thumb and the first finger for use both hands to palpate deeply to assess for palpation. So now we are going to palpate for the liver. Stand at the client's right side and place the left hand under the client's back at the level of the 11 and 12 ribs. Lay the right hand parallel to the right costal margin. The fingertips should point toward the client's head. Ask the client to inhale, then compress upward and inward with fingers. Note for consistency and tenderness. So sir, I'm going to put my my left hand under your back. Is that okay with you? Okay. Okay, thank you. So now, palpate by hooking. Stand at the right of the client's chest. Curl the fingers of both hands over the edge of the costal margin. And ask the client to take a deep breath and gently but firmly pull inward and upwards with our fingers, and note for any consistency and tenderness. So sir, kindly take a deep breath for me please. Exhale, inhale, exhale. Okay, thank you. So now we are going to palpate for the spleen in a two-way method. Ask the client to turn to his or her right side. So sir, kindly turn to the right side for me please. Okay, and palpate the spleen by moving it downward and forward. And document the size in centimeters below the left and costal margin, and note for any consistency and tenderness. Place the kidney. Okay, sir, you can now lay in your bed, please. So now, palpate for the kidneys. Place the left hand on the right posterior flank and provide it support. Place the right hand on the right upper quadrant just below the costal margin of the midclavicular line. And ask the client to inhale and hold briefly and gradually release the pressure of the right hand. And repeat steps for the other kidney. So sir, kindly inhale for me please. Can you take a deep breath for me please? Exhale. Kindly take a deep breath for me please. Exhale. Okay, thank you. Test for the pause. Palpate for the kidneys. Begin palpating at the symphysis pubis and move upward and outward to estimate bladder borders. Note for any consistency and tenderness. And now, test for the psoas sign. Ask the client to lie on the left side and hyper-extend the right leg of the client, and note for any pain and reaction of the client. So sir, is it painful? So now, test for the obturator sign. Hold and support the client's right knee and ankle. Flex the hip and the knee and rotate the leg internally and externally, and note for the pain and reaction of the client. So is it painful, sir? And now, test for the appendicitis. Assess for rebound tenderness by palpating deeply at 90 degrees in the abdomen away from the painful or tender area. Suddenly release pressure. Listen and watch for the client's expression of pain, and ask the client which hurt more, pressing, pain, or releasing. Ask the client whether in the abdomen pain occurred. Is it painful, sir? So now, sir, we are done with the assessment, and I'm going to summarize all the information that I've gathered. rest assured that all the information that I've gathered is confidential and secure, and it is handled directly to the doctor. So your findings for your vascularities is that scattering fine veins is mainly visible than blood in veins located above the umbilicus that flows towards the head of the body. Findings for serrate, all silvery white, straight, or stretch marks from the past pregnancy or weight gain are normal. Pale, smooth, and minimally raised old scars are normal. I see that you don't have any lesions or rashes, which is good. Umbilicus skin tones are similar to surroundings of abdominal symptoms or even pinkish, also umbilicus in middle and lateral line. Abdomen is flat, scripoid, and it is very evenly rounded and symmetric. There are no peristaltic waves seen. In auscultating, there were no brute sounds heard over the abdominal aorta. No venous hum was heard over the umbilical areas. There was no friction rub was heard in your liver. Also, in percussing, there were general symphony over the abdomen. Normal findings is that it has a deep breath inspiration. So your liver span is 9 centimeters, which is good and normal. Your spleen is normal because it measures 7 centimeters wide near the left 10 rib, slightly posterior to the mid-axillary line. It is normal because your tympani is heard in the left interspace. There is no tenderness inspected. No palpitable masses are detected. Findings of the kidneys are not palpitable. No rebound tenderness is present, and all the findings are normal, which is great. And also provide the client with a health education. So, Sir Ben, I suggest you to get plenty of fiber because high fiber diets promotes regular bowel movements and may protect against many digestive disorders. I also suggest you to drink a lot of water because it is good for your digestive system, and eat on time because it will help to keep your digestive system in top of shape, and also exercise regularly because it will help you to keep foods and moving through your digestive system. And also, don't forget to perform hand washing. And also, summarize the information obtained during the working phase and discuss the findings with the client. And discuss the client's possible plans to receive health concern, and also assess for the client's understanding of the plan and need further teaching to provide clients opportunity to clarify and ask or raise questions. So take the client and end the interview politely, done with a aftercare or perform hand washing, and also document the findings in the client record using the printed or electronic forms or checklist supplemented by the narrative when appropriate. And also maintain body mechanics throughout the performance of the assessment, and observe neatness and orderliness with performing with the assessment, and observe courtesy, showed calmness, and maintain calm posture while exercise proper and fluent use of English language. So, sir, are there any questions or concerns that you might to ask? Okay. Sir, thank you for your time and cooperation, and have a nice day. So that's it for the assessment of the abdomen.